Hey everyone! Today, we're diving into a topic that affects millions of people around the world, lower back pain. Whether it's a dull ache, a sharp stab, or something in between, lower back pain can really impact your daily life. So, let's break down what it is, why it happens, and most importantly, what you can do about it. So, what is lower back pain? Lower back pain is any discomfort or pain felt in the region of the lumbar spine, which is the lower part of your back, right above your hips. As our back is incredibly complex structures, made up of vertebrae, those bony building blocks, discs that act as cushions between them, ligaments that hold everything together, and muscles that provide support and movement. Nerves run through the spinal column, connecting our brains to the rest of our body. When any of these components are irritated or injured, it can lead to that all-too-familiar back pain. Now, what exactly causes this pain? Well, the reasons are quite varied. One of the most common culprits is muscle strain or sprain. This can happen from lifting heavy objects incorrectly, sudden awkward movements, or even poor posture over time. Think about hunching over your computer. That puts a lot of stress on your back. Then there's posture. Spending long hours hunched over a computer, slouching on the couch, or even standing with poor alignment can put undue stress on your lower back. It's like constantly leaning a tower. Eventually, it's going to complain. Another frequent cause is disc issues. These discs, our shock absorbers, can sometimes bulge or herniate, putting pressure on nearby nerves. This can lead to pain that radiates down your leg, often called sciatica. Sciatica is another term you might have heard. This isn't a condition itself, but rather a symptom where pain radiates down your leg, sometimes all the way to your foot. It often happens when the sciatic nerve, which runs from your lower back down your legs, gets compressed or irritated, often due to a herniated disc. Imagine a nerve getting pinched. It can send shooting pains down its pathway. We also can't forget about injuries. Accidents, falls, or sports-related incidents can directly damage the structures in your lower back. And sometimes, less obvious things like stress can contribute to muscle tension and back pain. Our bodies are interconnected and emotional stress can manifest physically. Additional common factor, especially as we get older, is degenerative disc disease. The discs between your vertebrae can lose their cushioning and become thinner, which can lead to pain and stiffness. Less commonly, back pain can be a symptom of more serious conditions like spinal stenosis, which is the narrowing of the spinal canal, infections, or even, in rare cases, tumors. That's why it's always important to pay attention to your body and seek medical advice if you have persistent or severe back pain. In addition to above causes, other factors like obesity, pregnancy, or even stress can increase the risk of developing lower back pain. Okay, so we've talked about why lower back pain happens. Now let's get to the good stuff. What can you do about it? The great news is that for many people, lower back pain can be managed and even prevented with the right strategies. One of the first lines of defense is often rest and activity modification. While complete bed rest isn't usually recommended for long periods, avoiding activities that aggravate your pain is key. However, staying completely still can actually make things worse in the long run. Gentle movement, like short walks, can often help. Think of it as finding that sweet spot between resting and moving. Gentle stretching and exercises are also crucial for strengthening the muscles that support your lower back and improving flexibility. Things like knee-to-chest stretches, pelvic tilts, and cat-cow stretches can make a big difference. It's like giving your back a little tune-up. Always listen to your body and avoid any movements that cause sharp pain. Proper posture, as we discussed, is also vital. Be mindful of how you sit, stand, and even sleep. Using lumbar support when sitting, keeping your shoulders back and down when standing, and sleeping on your side with a pillow between your knees can all help maintain spinal alignment. Think of it as building a good foundation for your spine. When it comes to lifting, remember the golden rule. Lift with your legs, not your back. Keep the object close to your body and avoid twisting. It's like using the right tools for the job. Your strong leg muscles are designed for lifting. Maintaining a healthy weight can also significantly reduce the stress on your lower back. Excess weight puts extra pressure on your spine. Think of it like carrying a heavy backpack all the time. It takes a toll. Don't underestimate the power of stress management. Techniques like deep breathing, meditation, or yoga can help relax tense muscles and reduce overall pain. It's about calming both your mind and your body. Now it's important to know red flags that tells you when to seek professional help. If your back pain is severe, doesn't improve with home care after a few weeks, radiates down your leg, is accompanied by numbness, weakness, or bowel or bladder problems, please see a doctor. These could be signs of a more serious issue that needs medical attention. A healthcare professional can properly diagnose the cause of your pain and recommend the best course of treatment, which might include physical therapy, medication, or in some cases surgery. Lower back pain is a common problem, but it doesn't have to control your life. By understanding the potential causes and implementing these self-care strategies, you can take steps towards a healthier, pain-free back. What are your experiences with lower back pain? What has helped you find relief? Share your tips and questions in the comments below. We can all learn from each other. And as always, if you found this video helpful, please give it a thumbs up and subscribe for more health-related content. Thanks for watching, and I'll see you in the next video.